Fewer people are having fewer kids. The U.S. fertility rate has been declining for almost 20 years. The lowest point, 2024. Health experts say there are a lot of variables contributing to the decline, including financial worries and later marriages. Joining us to talk about that and other health stories is Dr. Jeff Pothof, UW Health's Chief Quality Officer. You do. Before, my parents' generation, 5 kids, that was just kind of like the norm.
Absolutely. Back in the 1960s, it was like over 3.5 kids per woman, which, today, like you mentioned, this last year was our lowest, 1.599, rounded up to 1.6. For some individuals, that's causing some concern. If the idea is to replace the population and it's a couple, you want each woman to have about, 2 kids. And some people might think that the issue is that, women are just like less fertile or men are less fertile and they can't have kids, but that's really not the case here. What's happening is I think it's probably smart family planning. A lot of women are going on to get, college degrees, advanced degrees. They want their own careers. They know that putting off childbearing kind of helps facilitate that. And then children, they're expensive. I mean, even if you look at the cost of just a daycare for children, I think folks are being, we got to be a little bit more financially secure before we start having a family.
That makes sense. But you say you don't think that it's a fertility problem yet. I know of so many women, young women, who have struggled to conceive or carry a child. So is that it just seems that way, or are we actually seeing the numbers to support it?
Yeah, certainly I think we're better at identifying fertility issues, and then we have so many better treatments nowadays that can help women or, women and men. It's not just a women problem, conceive when they otherwise couldn't. But it seems the driver of this is more of like the decision to delay having a family rather than, we're trying really hard to have children and we can't.
Okay, let's move on. European regulators have approved an injectable HIV drug. This is great news.
Yeah, so this is lenacapavir, and what's so interesting about this medication is that it lasts a long time. So we currently have medications that people can take daily to try to prevent coming down with HIV. There is an injection. It lasts about 2 months. This one lasts 6 months. So if you're in a situation where you're at potentially high risk of coming down with HIV, or they even use this to treat HIV, and all you have to do is get an injection once every 6 months, much more tolerable, much less likely to forget. And the data behind effectiveness is really good for this medication. The con that's being out there right now is it's pretty expensive. So will we be able to make this affordable, especially in the places that need it the most, sub-Saharan Africa and things like that?
All right. How many steps a day should I be taking to be healthy?
I've got great news for you. I feel like I come on here and I tell you you're not eating right, you're not exercising enough, you're drinking too much wine and smoking. Today, you can cut back from 10,000 steps a day to 7,000 steps per day. This is a pretty large study coming out of Europe looking at, when do the health benefits start to plateau for, just that low-level intensity exercise. It's about 7,000 steps a day to see reductions in heart attack, stroke, even things like dementia and cancer. So, 10,000 is great, but if you're only hitting 7,000, you can give yourself a pat on the back today, too.
How reliable, in your opinion, are your cell phone? Because sometimes I feel like I'm being cheated.
Yeah, I think it goes both ways. There's sometimes where I'm like, I did not get 47,000 steps today. I think it really has to do with the technology. And a lot of these things, you have to train them to like stride length and things like that. So, my iPhone, I don't get too upset if it likes me or hates me. But there are technologies out there that can be pretty good on counting steps.
Right. And if I'm on the couch all day, it's probably accurate.
That's true.
All right. Thanks, Dr. Pothof. Have a great afternoon.
You bet. Take care.